Hey guys, Dr. Andrew here from Chiro Wellness Centre. Hope you're having a wonderful Friday and welcome to today's episode of the Chiro Couch. Now, the question I'm going to cover today is, are you too young or too old to have chiropractic care? Well, first up, the answer is no. There are no age restrictions, but there are some conditions when it comes to accepting chiropractic cases. And obviously, treatment types will vary whether you're adjusting a baby, or whether you're adjusting a child, an adult, or somebody with osteoporosis, for example. But it comes down to the chiropractor's experience in their examination, radiological findings that will determine whether chiropractic care is right for you. And of course, this is not related to age. As for children and infants, chiropractic care can be safe and effective. In fact, in 2019, there was an independent review requested by the Victorian government. Now, it was requested because there was a Facebook video done of a chiropractor adjusting a baby. And it was requested by the Victorian Health Minister, who wanted chiropractic banned from treating children. Now, this was under the age of 12. Fortunately for us, at the end of review, there was no evidence suggesting that chiropractic care was unsafe for children. Now, it brings up the question, would you take your child to a chiropractor? And if so, what age? Well, here at Chiropractic Wellness Centre, both myself and Matt have done pediatric training at university and postgrad as well to keep up to date with the appropriate adjustments and treatments for infants and children. Actually, when I was at university, the way that we were taught how to treat children was we actually pressed on each other's eyeballs. That's how much pressure we actually use. That's the maximum amount of pressure we would use on a baby. Now, we don't adjust the spine like we would like an adult. It's actually very rare to adjust a baby or toddler like we would with a normal adult. But we use specialized tools like an activator, or we have a slightly stronger device with an arthrostim, and these work gently to help improve the spine. But I hear very regularly that kids don't need chiropractic, and it's just not true. Kids have all types of health issues. It doesn't mean they can't have a spinal problem. And in the majority of chiropractic cases, we just focus on the spine growing healthily through the different stages of development so that you don't get the problems, your child doesn't get the same problems as what you do, because there are a lot of genetic conditions out there, like scoliosis, for example, or kids' injuries, for example, that if left undetected would lead to problems later on in life. So if you're a parent, it's a good idea to get your kids' spines checked regularly. Whether they need treatment or not, that's up to the chiropractic. Now, adults of all ages can have chiropractic care before, whether it's managing chronic pain, improving mobility, enhancing wellness, injuries, posture, etc., etc. And different techniques will vary depending on what it is. Now, for older patients, we might use that impulse instrument that I was showing you before. Certain age-related issues like arthritis or joint stiffness or limited mobility will work really well when using that on an older person's spine. It is safe to adjust osteoporosis as long as we be gentle with it. Now, chiropractors may do other techniques like gentle stretching, some exercises, things that you can do at home to help you alleviate your discomfort. Now, that arthrostim is safe and effective, and we use it on all adults, but it's really good on those arthritic spines, and it's a perfect way to align the spine in a positive way to help you improve your function, but also improve your musculoskeletal system as well. So finalizing everything, when working on individuals, regardless of the age spectrum, whether it be very young or very old, chiropractors take extra precautions to make sure we modify our techniques for your condition and, of course, your age. I checked my kids on their first day of life. I've checked patients in their late 90s and 100s, and each person has a different set of circumstances, health conditions, and, of course, risks, regardless of any age. So if anyone tells you that you can't have chiropractic because of your age, tell them they don't know what they're talking about. In any case, if you know somebody that might be too young or too old, in inverted commas, to have chiropractic care, tell them what you just heard there, or share this with them, because all our recommendations of chiropractic care are based on fact and based on whether we can help you or not. And rest assured, in this office, we'll do everything possible to tick our boxes, cross our T's, dot our I's, and lowercase j's to make sure chiropractic is safe and effective. And if you have any questions, please give us a buzz on 5562-1311. Leave a message on our Facebook page or just give us a call. Anyway, my name is Dr. Andrew from Chiropractic Wellness Centre. Hope you have a great Friday. Bye for now.